My name is Frances Padilla, and I adopt the testimony I previously filed.
Thank you.
I come before you as president of the Universal Healthcare Foundation of Connecticut, where we advocate for transformative systems change to improve access, quality, and affordability for everyone in our state. I've also served on the Board of Trustees of the Hospital of St. Raphael in New Haven and on its Finance Committee, where we struggled mightily over the years with the challenges of reconciling mission and margin. Ultimately, we all know how that story ended with the acquisition of St. Raphael's by Yale New Haven hospital system. My remarks today will focus on the consumer, the patient, and the community impact of the proposed Waterbury purchase. The conversion of a nonprofit community hospital is a complex undertaking, not an easy course of action to decide. A community hospital is a local treasure, a trusted source of care at times on a planned basis and at other times on an emergency basis. It's also a long-standing local institution, an employer of many types of professionals and supporting staff, often a principal source of employment for the residents of the surrounding neighborhoods, a member of the local business community, and a part of the civic infrastructure supporting charitable and educational activities in the community. I respect the due diligence of the Waterbury Hospital Board and leadership as it wrestled over the past several years on how best to protect the future of hospital care in the greater Waterbury area. Excuse me. As we at the Foundation observe the process unfolding in Waterbury and elsewhere in the state, several concerns arise which I will outline and also offer some recommendations. The current trend of hospital consolidations and conversions is happening in the context of health reform, where the Affordable Care Act seeks to improve access to care, reduce costs, and improve quality. Hospitals readily point to the ACA's heightened focus on accountability and value-based reimbursement as a driving factor behind these trends. Consolidations and conversions are held up as the only defensible options to ensure the fiscal viability of hospital services and communities. The Affordable Care Act seeks to keep people out of the hospital, calling upon hospitals to retool their care model to play a different role in preventing illness and complications of illness. As a for-profit enterprise accountable to shareholders, we worry, frankly, that for-profit hospitals are more likely to develop or expand profitable lines of service, such as open heart or orthopedic surgery, and minimize or drop less profitable ones, such as psychiatric services. It is important to continually bear in mind who lives in Waterbury and the surrounding communities to be served by the proposed conversion. Waterbury is a community, not a market, with many community, economic, and social challenges. Priority health issues in Waterbury include access to care. Of the people enrolled through the health insurance exchange in its first enrollment period, there were about 20,000 people without insurance here in Waterbury, and just over 5,000 were enrolled. So there remains still more than 15,000 people uninsured in Connecticut, in Waterbury. Mental health and substance abuse issues. Waterbury has the highest rates of suicide in our state. Overweight and obesity and tobacco use. Their chronic illness and the need for coordination of care to improve the conditions of chronic illness are very, very essential services that did not appear in the list of essential services previously cited. While cost, prices, and profitability may be Waterbury Hospitals and Tenet Healthcare's driving concerns, access to essential services and affordability are the consumer's concern, particularly for the city's working poor and Medicaid populations. The CON states that programs such as the Waterbury Access Project and its behavioral health services will be continued as long as grant funding is available. So it's really unclear whether those services will continue if grant funding from the state is not available later on. It's also unclear that any charitable foundation would be able to continue to help support those types of programs, which usually are much more costly than foundations can afford to fund through grants. excuse me, Connecticut's one for-profit hospital conversion, Sharon Hospital in rural Litchfield County, offers some lessons to consider in the current deliberations. You will hear public comment later today from Nancy Heaton, CEO of the Foundation for Community Health, which is the conversion foundation resulting from the hospital sale in 2004. In that case, Attorney General Blumenthal called for the creation of a community board appointed by the hospital to collaborate on the community's ongoing needs. Actual experience has been that the board is unable to obtain much useful information from Sharon Hospital. It is reported that the hospital does not share information they collect concerning community health needs with the board nor the foundation, and it has been generally uninterested in joint efforts to collect data. Access to certain services, including reproductive health and the free care program, have declined in the years since the conversion. Our colleague foundation desperately seeks information to help the community identify what it would do if the hospital downsizes or sells again, which has already happened once. What's needed in their community? How could they stop further downsizing if they needed to? And what makes sense? In retrospect, the Sharon experience helps us see that the community board should be independently appointed, its roles explicitly articulated as part of the conversion approval process, with clear authority to obtain information central to assessing issues regarding access to and affordability of essential services. There should be clear recourse for the board when such information is withheld. Charitable purposes of the Conversion Foundation should be safeguarded from capital calls or to replace health services that are more appropriately funded in other ways. Foundations cannot underwrite ongoing costs of essential health services. If the Office of Healthcare Access and the Attorney General decide to approve this sale, it should be with protections ensuring the preservation of good jobs, commitment to hiring locally, and community access to essential services and community benefit standards. To further keep the focus on the quality provision of essential health services and transparency, the Universal Healthcare Foundation also recommends that the composition of the hospital's governing board include 51% patients and hospital and medical staff who, without relegating such members to Class B status. And I echo the call for racial, ethnic, and gender diversity in governance. Absolutely essential. In addition, all for-profit hospitals should be required, including Waterbury Hospital and St. Mary's, to conduct community health needs assessments and make them public as required of nonprofit hospitals by the ACA. Voluntary compliance is insufficient. The preceding recommendations assume that the Waterbury Hospital Tenet conversion proposal may be approved, as may others. The trends these particular cases have created are rooted in reimbursement revenue pressures, declined volume, excess bed supply, and need for access to capital. Payment reform expectations challenge hospitals to develop new capacities to completely retool their model. Care coordination, data analytics, risk stratification, all capacities that require money and brain power. These pressures are accelerating these trends, and the ramifications of the trends are yet to be fully understood. Much of the basic redesign of the hospital infrastructure in Connecticut is happening out of fear, uncertainty, and worry about market position. A siege mentality has taken over. There appears to be little strategic intent by state regulatory and legislative bodies to facilitate planning for a hospital system that meets the needs of 21st century Connecticut and that begins with a focus on population health, not individual hospital survival. The Foundation gave testimony to the legislature's Public Health Committee in February of this year, recommending that even if these particular deals are approved in the short term, with protections, there should be a moratorium declared on future deals. Once again, we call for a moratorium. Perhaps the recently formed legislative task force on hospitals, with all public, private, and community stakeholders at the table, should carry out rigorous analysis of current and projected community health needs, the options available to hospitals for meeting them effectively and efficiently. A moratorium should be declared for a reasonable enough period to allow evaluation of Connecticut's experience with the models at play, consolidations, conversions, and hospital affiliations such as the Value Care Alliance by 7 community hospitals resisting the current trends. The task force should identify regulatory and legislative measures to ensure hospitals' viability while protecting the health interests of the state's residents. In closing, even if consolidation is the right thing, it needs to be done in a planful, deliberate, and rational way with built-in accountability mechanisms. Thank you for the opportunity to present to you today.
Thank you.